Yeah. Standing between you and coffee is not a great place to be, but hopefully you'll find this talk interesting. It's going to be slightly different to what you've heard so far this morning, but no doubt I think it's going to be relevant, and it ties in, I think, with some of the previous presentations. So I'm going to present to you about a conference that we held in April, just gone, in UCC. And my co-chair, Dr. Kieran Dalton, who couldn't be here today, and myself led this conference. So what I'm going to talk to you initially is a bit of background about the conference, what it was about. Then I'm going to give you some highlights from the conference, both our plenary speech and some of the research that was presented. I'm going to talk you through a very brief case study, and then just maybe finish on some take-home messages and some points about future research. So what is the HSRPP conference? So it stands for Health Services Research and Pharmacy Practice. It's an international conference. It's held every year, and in April we held the 30th conference in UCC. And really what the conference tries to do is give a platform to academics, researchers, and also healthcare practitioners to disseminate research that they do on medicine's safety and medicine's use, and really in order to try and improve practice, because that's really what we want. We want our research to try and influence how we help patients, and also how we can influence policy and the delivery of services. So we welcomed over 100 researchers from across Ireland, the UK, Europe and Canada to UCC. The conference itself was a great success. We had as our theme sustainable development in healthcare, which is really how and why I'm standing here in front of you today. And back in 2021, when we were putting in our bid to host the conference, I suppose even back then we were very aware of the importance of sustainability in healthcare. As Colette alluded to with the UN SDGs, it really is a key issue for policymakers, for health systems, but really on the ground, it is becoming more and more, I suppose, an issue for us as practitioners and how we deliver patient care. So sustainability, as we understand it, is how can we, I suppose, ensure that we meet the needs of our patients without compromising the ability of future generations, such as yourselves as pharmacists going into the next 20, 30 years, and your ability to deliver care to patients at that point. So I'm now going to move on to, I suppose, some of the key messages from our plenary speech. We invited a speaker, Barry Melia, to be our keynote speaker. Barry is an Irishman. I think he comes from not too far from here, but he is working in Scotland with NHS Scotland. So he's the principal pharmacist for Public Health Scotland, but he wears a lot of different hats, and many of these are in the area of environmental sustainability. So Barry really has a lot of experience and expertise in this field. So we were delighted that he was able to join us and to give us a talk. So I'm going to share with you some of the points that he shared with us. So I'm going to start off, and I'm going to ask you to give me a show of hands. Okay? It's very easy. Do you believe that climate change is impacting you, your community, and your area of work? So if you can put up your hands if you think that that is the case. Okay. So pretty unanimous, I think, there. Do you believe that the provision of healthcare is a major contributor to climate change, environmental pollution, and biodiversity loss? Again, just if you can raise your hands if you think that that is the case. Okay, so a little bit less, I suppose, different views. Do you believe that technological innovation will allow current practices to continue? Can we continue doing what we're doing and rely on technology to solve the problem? Hands up if you think we can. There's no hand up. Okay. Do you believe climate change is too overwhelming and individual actions won't make a difference? Hands up if you think that that is the case. Okay, so again, I think there might be a few hands that were kind of tentatively going up, but yeah, it's interesting. I think across the room, there's a sense that it is an issue. Okay. What is the view of public health on this matter? Does it align with what we think? So the WHO believe that climate change is the single biggest health threat facing humanity. So they would certainly agree with us that it is a significant issue. And it affects the social and environmental determinants of health, the things that we take for granted here. Okay, clean air, safe drinking water, having sufficient food and secure shelter. Climate change is going to impact and affect all of those. It's believed in the next 20 years that climate change is going to cause approximately 250,000 additional deaths due to things that are related to those. So whether it's malnutrition, whether it's heat stress, diarrhea, and so on. And as we've come to expect, unfortunately, those who were most affected are those who were least able to mitigate against these. So we know that countries and areas which are particularly vulnerable to these. So it is more than just a health issue. And obviously there's a focus today around the economic and some other, I suppose, considerations. So it does impact on both social and economic well-being. What are the sectors that drive this? Okay, so we heard about, I suppose, lots of the innovations and initiatives that are happening within the farming sector, and certainly there is, I suppose, a narrative about the role of agriculture. There's also areas such as energy processes and so on. So we know that there are those areas which are, I suppose, significant contributors to this. But my question to you is, how much does health contribute? So data from the UK, the Health Policy Partnership, believe that healthcare sector contributes about 5% of global carbon emissions. So if the healthcare sector was a country, we'd be the 5th largest polluter in the world. Okay, so it is a significant area which contributes to this problem, equivalent to about 514 power plants. So we don't have data from many health systems, but the NHS did look at a mapping exercise to see, well, within the healthcare sector, where are the emissions largely coming from? And if on the pie chart that you can see there, you can see that medicines, medical equipment, and other supply chain really is a large contributor to this. Okay, and this is obviously an area in which we work in when we look at medicines, pharmaceuticals, and so on. But there's other also things such as commuting, patient commuting, and other things. So there's lots of opportunities for us as pharmacists to see where we can make changes. So about 25% of the carbon emissions are from medicines. About 20% come from the likes of manufacture, supply chain, and the use of medicines. About 3% come from inhalers, and that's going to relate to a case study that I'm going to talk about in a little bit. But it's not all about carbon. We know that a lot of our pharmaceuticals end up in the environment, whether that's in the soil and in our waterways. And again, as pharmacists, we have roles to play in educating our patients about how we can dispose of medicines. And again, there's some research that I'll talk about in relation to that. So we know that there is significant biodiversity loss, and this also leads to a risk of increased antimicrobial resistance that has been found because of medicines making their way into the environment. My question to you is, will technology save us? And there are innovations happening in this field, but they're not happening fast enough. So that is not going to be how we solve the problem. So the question is, is this too overwhelming? Is there individual actions, will they make a difference? You might recognize some of the pictures on the left of the screen, kind of down from my neck of the woods last year in Middleton, where we had significant flooding issues. And that is probably going to happen more and more often. And to be honest, we're probably used to seeing these things more often now. And the impact that this is going to have in terms of health and well-being, is significant. But thankfully, not all is lost. So We do need to move, we need to make changes, and we need to adapt what we do. To borrow from our Tesco colleagues, every change helps. So that idea that as an individual, can you make changes that will help? Absolutely, yes. And we can take actions at different levels. Okay, personally, as a person who operates in society, are there things that you can do? Can you do things within your community and at a professional level? So it's really about evolution, okay? We're not going to have a full revolution in this area because of how we live and how we, operate as a society. But certainly at a personal level, there are lots of things that we can do. And many of these things are going to be things that you're familiar with, whether it's in terms of dietary changes, maybe traveling, recycling, reusing, and so on. So there's lots of areas where people can make individual changes. At a community level, and pharmacists are really embedded within the community. So again, we have a role to play in merging that professional and community hat in terms of things that we can do at a community level to make changes. And again, I think we are seeing lots of these changes happening in our community. And at a professional level, again, and Colette really highlighted some of these things that we can do. We can do things as pharmacists, but I think to make a maximum impact, we need to look across disciplines and across the health service itself to have that maximum impact. But there are lots of things that we can do. We can look at energy. We can look at the resources that we use, and they can be very simple changes that will make an impact. So Barry left us with this real call to action, for us as pharmacists to think about what we can do to really lead that change. And then we saw some presentations and some research that people presented at the conference, and I'm just going to give you a very brief overview of some of these. So the first of these was a survey that researchers conducted that looked at people's perceptions and behaviours towards disposal of medicines. And I suppose there's some of the key takeaways from there is just less than a third of people had returned unwanted or unused medicines to a pharmacy. About a third of people had disposed of them in their household waste, so whether that was in solid waste or down drains. And about 2/3 of people were aware that they could return medicines to a pharmacy. So again, you can see that there's a very simple education piece that we can give to our patients to say, if you're finished with this, if you're not, how often do we know that when we dispense antibiotics, we know that person is going to have 2/3 of a bottle left over? Can we educate them to say, this is what you should do when you're finished? Don't tip it down the sink. There was another survey that researchers presented looking at people's views and behaviours around inhalers. And if you remember that statistic at the start, that 3% of carbon emissions are relating to inhalers. So they looked to see, what are people's views about using inhalers? And what they found is that nearly 2/3 of people would be willing to switch their inhalers to more environmentally friendly inhalers if they were both equally effective. So that's a really strong message there to say that there is an appetite from patients to make changes if it doesn't impact on their health and it's more environmentally friendly. And then the last study was one that looked at very simple initiatives. These aren't complicated or these aren't high-tech research. It's basically looking at a service where they had delivery of prescriptions to patients, and they looked to see, could they synchronize their deliveries? So could they then make it more efficient how they delivered prescriptions to patients? By doing this, they found that they could reduce by over 70% the carbon emissions and the distance travelled by doing this simple initiative. So again, some really straightforward and tangible examples of how people made changes. You'll see the QR codes there on the screen. All of our abstracts were published in a journal, so all of them are up there if anyone wants to have a further look at the information. And then I just want to briefly touch on a case study that we looked at within one of the workshops, and this was delivered by both Barry and a colleague of his from Queen's University in Belfast. And it was talked about making the right choices, but what you'll see underneath it, it says with the patient and for the environment. And that's a really important message because we have to involve patients in these decisions. This isn't about imposing any changes on patients, but it's about involving them in decision making and that shared care piece. So I'm going to talk you through the case study. If we had a bit more time, we'd maybe discuss it in groups. But this is a patient. So we have a patient called Suzanne Smith. She's a 37-year-old patient. And you're the community pharmacy, and you're providing a service within a local GP practice. So just to give you a bit of background about our patient. So she's a busy mum of a 1-year-old child. She works in a 0-hour telesales role. She's attended you because her prescription for her Ventolin inhaler has run out and she needs some more. And on presentation, she's wheezy, but she doesn't really have a huge amount of time to talk to you because she needs to get back to her job because there's stresses within the work environment. Her medical history is that she has asthma and musculoskeletal pain. And you can see her medication history there, which includes 2 inhalers, Ventolin and Becotide. And she also takes diclofenac, which is an anti-inflammatory medication. And she takes that for the pain relief. So, where would we go with this? If we thought of this under these 4 questions or these 4 points, what matters to the patient? Are the desired outcomes of therapy being met for her? What are those individual lifestyle factors which are important? And what are the issues around maybe medications and appointments that exist? So what matters to her is job security, and by extension, being able to provide for her daughter. In terms of her conditions, being able to manage her symptoms is important, and getting pain relief is important. Environmental concerns are not particularly important for her. Okay, and that's important because obviously we need to be cognizant of what matters to the patient, and for her, those are her concerns. Are the desired outcomes for therapy being met? So she is managing her pain on diclofenac. As long as she uses her salbutamol, she's managing her wheeze. She's not sure about why the Becotide is prescribed. And she's had to go to hospital and out-of-hours services several times over the past year when she's been given prednisolone, so steroid tablets to try and manage the symptoms. If we think of individual lifestyle factors, she vapes. This allows her to skip meals. She rents an apartment which has mold in the kitchen, and she has no family around to support or to provide regular support to her. And in terms of medication use and appointment use, she struggles to attend appointments, but we do find out that she has a good inspiratory effort. So the information here comes from a resource from the BMJ last year, which was looking towards a net zero NHS with a focus on asthma care. So I suppose some of the key points that comes from this article are, first of all, the fact that when we use pressurized metered dose inhalers, we use the propellant hydrofluorocarbon. That disproportionately contributes to emissions. Okay, so we know that using those has a deleterious effect on the environment. If we can reduce the use of those, we also improve clinical outcomes for patients and planetary outcomes. So it's a win-win if we can reduce the use of those. When it's clinically appropriate, we should consider trying to reduce and move away from some of those higher carbon inhalers to lower carbon inhalers, and that can include the use of dry powder or soft mist inhalers. We should seek opportunities to review asthma care at every consultation. And remember that patient-centric decisions are also most likely to be environmentally friendly. So for a patient like this, there's loads of things that we could consider. We could consider, is it really viable that she is maintained on an anti-inflammatory? Could that be making her asthma symptoms worse? Could we look at non-pharmacological measures to manage her pain and maybe hopefully get rid of the pain? And then she doesn't need to use diclofenac. Could we look at her environment? We know that triggers such as mold are going to make asthma symptoms worse for patients. So again, maybe we could reduce the need for her inhaler use. We know that patients who use short-acting bronchodilators have worse clinical outcomes Okay, and that's where she is. She's had to go for several appointments. Think of the transport, going to hospital. Think of the fact that she's had to maybe miss work, childcare, and so on. Okay, so can we look at maybe changing her inhalers? She doesn't know why she's using Becotide, so she probably doesn't use Becotide. Okay, so can we look at getting her using the medicines that she is supposed to use appropriately? Maybe we can swap her over to something like smart therapy. Maybe it's one inhaler. It's reduced carbon. She has better clinical outcomes, and we have better outcomes in terms of an environmental perspective. So that's just, I suppose, a very short case to show you how we can involve the patient, we can improve clinical outcomes, but those outcomes can also have a benefit for the environment. And just to finish up with some points about future research, I think I do recognise one or two faces in the audience who've undertaken our MSc in clinical pharmacy, but if that is something that you're interested in, we do have both community and hospital pharmacists take the course, and as part of the course there's an opportunity to do some research. And we also have opportunities to do further research with part-time and full-time PhDs. So again, if that's something you're interested in, please do feel free to contact us. And just some take-home messages, and these came from Barry's slides again, but I suppose just to reiterate the point that change is possible, and all of us have a role to play in that. And they can be small changes. They can be the difference between turning off your computer screen, maybe using a water heater instead of a kettle. They can be obviously more significant, such as those that Colette alluded to. But those changes will build. It's about educating ourselves, the fact that you're here today. And again, Colette mentioned some of those courses that people, either yourselves or others within the pharmacy, could do in order to, I suppose, become more aware. And then that helps you again to make changes. Learn from others, but others will learn from you as well. And then I suppose to be brave to make some of these decisions, again, I think it is something that's coming down the line, because obviously we're all becoming a bit more aware of sustainability, and speak up and make those changes. So thank you very much.
Thank you, Suzanne. Any questions? Any questions for Suzanne? Just one there.
Hi, just as a pharmacist who was a couple of pharmacies and take back medicines, and last year alone spent over 2,000 on returning medicines. Is there any supports, or is it just the goodwill of pharmacy that we're going to depend on to get this over the line?
Yeah, that's a really good point. And to be honest, I think with a lot of the things that we're talking about, we need to look at how can we resource these things properly. If we want people to make changes, we do need to have it adequately resourced. I think from the sustainability point of view, because things go to pharmacy, the idea is that they will be disposed of properly compared to maybe if people are doing it themselves at home. So certainly we would... it should be something that pharmacists should be properly resourced to do, because if not, people, as you said, when you're having that kind of an output, that's that you're not always going to get goodwill to do that, and certainly on a more sustained basis. And if we want more people to do it, those costs potentially go up. So yeah, that's a good point.
Thanks very much, Suzanne. We're just going to take a quick 10-minute coffee break, so if anyone wants to get a tea and coffee, do just over there to the left. Thanks very much.